Why does symmetrical weakness happen in muscular dystrophy? Imagine a disease that affects both sides of your body almost equally, making muscles around your hips and shoulders weak. That's what happens in muscular dystrophy. The reason for the symmetry lies in how the disease works at a genetic level. Muscular dystrophy is caused by mutations in genes that produce proteins vital for keeping muscle fibers strong and healthy. These proteins, like dystrophin, act like protective shields for muscle cells during movement. When these proteins are missing or faulty, the muscle fibers become fragile and more prone to damage. Because the genetic defect is present in every muscle cell throughout the body, both sides of the body are affected in a similar way. This damage starts when the muscle cell membranes, called sarcolemmas, become unstable without proper dystrophin. This instability allows harmful substances, such as excess calcium, to flood into the cells. The calcium triggers inflammation and further injury, leading to muscle fiber death. Over time, the dead muscle fibers are replaced by scar tissue and fat, which weakens the muscles even more. This process happens uniformly across muscles on both sides because the underlying genetic problem is systemic, not localized. The pattern of symmetrical weakness is also linked to how the disease affects muscle regeneration. Normally, muscles can repair themselves using special cells called satellite cells. But in muscular dystrophy, these cells become depleted or less effective, causing the muscles to progressively weaken. Because these processes happen throughout the body at the same time, the weakness appears in a symmetrical pattern. This symmetry helps doctors distinguish muscular dystrophy from other conditions that cause uneven weakness, such as nerve damage or injury. Recognizing this pattern is important for diagnosis and planning treatment. Treatment focuses on managing symptoms and maintaining muscle function through physical therapy, medications, and supportive care. Always remember, if you or someone you know shows signs of muscle weakness, consulting a healthcare professional is essential for proper diagnosis and personalized care.